How to conceive naturally? What do you need to know? Hi, I am Dr. Ankita. I am a fertility doctor. I see many people who find difficulty in getting pregnant. When I do their consultation, I find that how much information about natural conception is there which people do not know. So if you are the person who is looking for getting pregnant naturally or have just started planning, this video is for you. So what you should know before you get pregnant? Number 1, you should subscribe to my channel so that you get fertility updates. In that way you can learn more about it. Number 2, you can track your menstrual cycle, whether they are regular and predictable. Say they are coming between 24 days to 35 days. I mean 1 week before or after is normal. Or if you have irregular periods, which are coming haphazardly, they are unpredictable, coming on day 45 or day 15, or they are coming after withdrawal pills, then you may find it difficult to conceive naturally. Number 3, you should see whether your periods are extremely painful or you are suffering from heavy menstrual flow. Then that may suggest that there is some underlying pathology like fibroid, endometrial polyp, or a deadly condition like an endometriosis. Number 4, you should know how are your menstrual period working. You should know, are you ovulating every month? What is the fertile window? And in that way it will help you in getting pregnant naturally. Number 5, your prenatal supplements and your prenatal tests are important to give you healthy conception. So firstly, let's understand our menstrual cycle. When female child is born, she is born with 2 million eggs in her ovaries. But by the time she reaches her reproductive age, only 400 to 500 eggs are left in her ovaries to ovulate. So it is crucial to understand the importance of age. As the age increases, the number of eggs are falling and the genetic quality of the eggs are also decreasing. Do you know what are your chances of getting pregnant naturally per month? If your age is 25 years, your chance of getting pregnant is just 25% per month. If you are 35 years and above, your chance of getting pregnant is 15% per month. And if you are 40 years and above, chance of getting pregnant naturally is just below 5%. So especially in Indian women, it is very important to understand that after the age of 35, the chance of getting pregnant dramatically depletes. So I am telling you that if you are a woman and you are menstruating and you are trying to get pregnant naturally, it is very important to understand basics of our menstrual cycle so that you can help yourself getting pregnant naturally. So let's see what our female reproductive organ consists of. Female reproductive organs consist of a uterus and a pair of ovaries, and most important, you have a brain. In a female brain, there is a pituitary hypothalamus axis from where all the female hormones are synthesized and they regulate the physiology of reproductive organ. When female is menstruating, this pituitary hormones, it secretes FSH, that is a follicle stimulating hormone. This FSH hormone, it stimulates the cohort of follicles in your ovaries and it helps in developing the follicles in the ovaries. Out of this number of follicles, only one follicle it gets dominant every month, and this dominant follicle it grows, and if it contains a good quality of egg inside it, it will synthesize a hormone, female hormone, which is called as an estrogen. This estrogen hormone is very important in development of your endometrium, which will help you in embryo implantation. When the egg is growing, more and more of estrogen is synthesized, and when this egg is matured, there is a peak of estrogen in the body which will signal back to your brain to synthesize a luteinizing hormone that will help in ovulation. When this luteinizing hormone is in the peak, it will cause ovulation, and this marks the first half of menstrual cycle. If your cycles are regular, then that means you are certainly ovulating. Now what happens after ovulation? After ovulation, this broken follicle is sealed off, and this is called as corpus luteum. This corpus luteum secretes another female hormone which is called as progesterone, which helps in pregnancy support. This progesterone hormone, it opens up and it closes this fertile window. So you have a very limited time to fertilize your egg and implant embryo in the uterus. If within this lifespan you are not in a relation, then you may miss the chance of getting pregnant that month. So this second half of cycle is called as a luteal phase, where it is a progesterone hormone which is supporting you for your pregnancy. If by some reason your egg was not good, then you may suffer from luteal phase defect, where you may expect your period earlier than your expected date. Or if by some reason the egg was not fertilized that month, then what will happen? This corpus luteum will get degenerated, progesterone level will fall down, and then endometrium will shed, and you will be again back to your period. Again the next month the same cycle continues, FSH is stimulating new cohort of follicle, and again you ovulate. So till now you have understood that to get pregnant every month ovulating is very important. In my next video I will be telling you how you can track your fertility window and how you can track your ovulation so that you can get pregnant naturally.